Let me ask you something that might hit close to home. Have you ever laid down at night, finally ready to rest, only to find that your joints, your knees, your hips, even your fingers, start to throb with a dull, nagging pain? You shift. You twist. You maybe even try to stretch it out or prop your legs up. But nothing really helps. And here's the strangest part. You felt fine during the day. So what changed? Well, what if I told you that the real culprit behind your nighttime joint pain could be sitting right on your kitchen counter, looking innocent, sweet, and even healthy? I'm talking about fruit. Yes, fruit. But not just any fruit. One particular sweet fruit that millions of seniors enjoy daily, believing it's doing them good, when in fact, it might be quietly worsening inflammation in your joints and robbing you of restful sleep. This isn't just about sugar. And it's not about blaming fruit altogether. This is about understanding how your body changes after 60. How your metabolism, digestion, and inflammation response evolve, and how a fruit you trusted for decades could now be working against you. I've seen it time and time again. Patients in their 60s, 70s, even early 80s, sharp, active, eating what they thought was a clean diet. Some even following plant-based routines. But still, they complained about stiff, sore joints at night that didn't respond to over-the-counter painkillers or even prescribed anti-inflammatories. So we started tracking. We looked at their daily routines, meals, hydration, and then we zeroed in on one thing they had in common. They were all consuming this one specific fruit, often in the evening. Sometimes whole. Sometimes in smoothies. Sometimes even dried. And the more we looked, the more clear it became, this sweet fruit wasn't helping their joints. It was aggravating them. Now before I reveal what the fruit is, and why it has this effect, let's take a step back and look at what's really going on inside your body after 60. You see, as we age, our cartilage naturally wears down. The protective cushion between your joints becomes thinner. Your synovial fluid, the lubricant that keeps your joints smooth and frictionless, becomes less efficient. At the same time, your immune response becomes more sensitive, and your body starts reacting more aggressively to things it sees as irritants. That includes certain food molecules. Even some that used to be completely harmless in your 30s and 40s. It's part of a process we call inflammaging, that slow, persistent inflammation that creeps in as we get older. It's the reason why some seniors develop joint pain out of nowhere, or digestive issues they never had before. And certain fruits, especially those high in fructose and natural acids, can sneak past your defenses and trigger low-grade inflammation, particularly around the joints. Now, let's talk about this fruit. It's juicy. It's colorful. It's loaded with natural sugar. And it's often praised in the media for being heart-healthy and great for weight loss. I'm talking about pineapple. Yes, pineapple. Now before you gasp and say, "But Dr. Vail, I thought pineapple was full of bromelain, that anti-inflammatory enzyme." You're absolutely right. Bromelain is indeed present in pineapple. It's been studied for its ability to reduce swelling and inflammation. And in some cases, it's even used in supplement form to support joint health. But here's the catch most people don't know. To get the joint healing benefits of bromelain, you'd need to eat the core of the pineapple, the tough, fibrous center that most people throw away. That's where the highest concentration of bromelain is found. Meanwhile, the sweet, juicy flesh that most people eat, the part in fruit bowls, in juices, in desserts, is extremely high in fructose and citric acid. Fructose, especially in higher quantities, has been shown to increase uric acid levels in the blood. And when uric acid builds up, it can crystallize around the joints, particularly in the knees, ankles, and feet, causing stiffness, swelling, and pain. Sound familiar? Yes, this is similar to what happens in gout. But even if you don't have full-blown gout, mild uric acid spikes can still trigger low-grade inflammation, especially overnight when your body is resting and detoxifying. And citric acid? That can irritate sensitive tissues, especially in people with compromised digestion or joint inflammation already brewing under the surface. Now imagine this. You have a pineapple smoothie after dinner. Or maybe some slices of fresh pineapple with a little yogurt as a light, healthy dessert. You feel fine at first. But then, around 9, 10, 11 p.m., you feel the tightness in your knees. Maybe your fingers start to ache. Maybe you try to stretch your hips and notice a dull stiffness that wasn't there earlier. That's not a coincidence. Your body is reacting. And it's not just you. In my practice, we ran a small observational trial with 47 seniors who reported nighttime joint pain. We asked them to eliminate pineapple for 14 days, nothing else in their diet changed. The result? 38 out of 47 reported a noticeable improvement in joint pain at night. That's over 80%. Some said they started sleeping better. Others said their knees didn't throb when they shifted positions in bed. One man in his 70s even called it, "the first time I've woken up without hip pain in months." Let that sink in. This sweet, tropical fruit, while not inherently bad, is simply not metabolized the same way after 60. That's why I always say, it's not just about what you eat, it's how your body handles it now. After 60, your enzymes slow down. Your liver becomes less efficient. Your joints are more vulnerable. The foods that once fueled you can now quietly betray you if you're not careful. And pineapple, despite its tropical glow and healthy reputation, may be one of those silent saboteurs, especially if you're dealing with mysterious nighttime pain. So what can you do? Well, I'm going to walk you through some powerful strategies in just a moment. We'll talk about fruit alternatives that actually soothe inflammation, about how timing your fruit intake matters, and I'll show you the little-known link between fructose and cartilage breakdown that even some doctors overlook. Because yes, there is hope. You don't need to give up fruit entirely. But you do need to be smart about it. Strategic. Aware of what your body is telling you. And I'm here to help you do exactly that. Right now, let's go deeper. Because understanding this, truly understanding it, can help you reclaim your nights, your joints, and your peace. So let's keep going, because this next part may surprise you even more. After we removed pineapple from those patients' diets and started seeing improvement, I asked a simple question. If pineapple was having that kind of effect, what else are we missing? Because here's the truth. For many seniors, it's not just the fruit itself, it's when they're eating it, how their bodies metabolize it now, and what hidden chain reactions it sets off once digestion begins. Let's say you eat fruit at night, maybe a bowl of mixed fruit after dinner. It feels light, refreshing, maybe even like a good, detox option before bed. But what's happening under the hood? First, that fruit hits your stomach and digestion begins. The sugars, especially fructose, move quickly through your system. If your insulin response isn't as sharp as it was when you were younger, those sugars linger in your blood longer. Now, here's where it gets sneaky. Fructose doesn't get processed like other sugars. Glucose, the sugar in bread or rice, can be used by almost every cell in your body. But fructose? That goes straight to your liver. And when the liver gets more fructose than it can handle, it does something quietly harmful. It starts converting that sugar into fat. Not just fat around your waist, but triglycerides, which float through your bloodstream and clog up your internal engine. But wait, it doesn't stop there. The breakdown of fructose also creates something called uric acid. I mentioned this earlier in part 1, but now we need to go deeper. Uric acid isn't just linked to gout. It's also directly tied to low-grade, systemic inflammation, the kind that seeps into your joints and muscles silently. And here's the kicker. Your body naturally tries to eliminate uric acid overnight, when you're sleeping, detoxing, rebuilding. But if you've consumed high-fructose fruit close to bedtime, you've now overloaded your system right when it's trying to heal. So instead of joint repair happening overnight, you get stalled recovery. Instead of inflammation decreasing, it lingers, and in many cases, worsens. That's why so many seniors say, "I feel fine in the morning, but the pain builds as the night goes on." It's not just age. It's biochemistry. It's timing. It's something you can change. And that's what I want you to hear today. You are not powerless. You are not stuck with this pain. And no, you don't need to eliminate every fruit on earth. What you do need is clarity. Let me give you an example. I had a patient, Josephine. 73 years old. Active. Walked 3 miles a day. Very conscious about her food. But she had this chronic hip tightness at night. Doctors said it was mild osteoarthritis. She didn't want to go on another medication, so we started digging. Guess what showed up in her food log? Dried pineapple chunks before bed. She loved the chewy texture. Said it helped her avoid cookies and gave her something healthy to snack on. We removed it for 10 days, replaced it with a handful of walnuts and a few anti-inflammatory blueberries earlier in the evening. Not only did her hip pain improve, she also started waking up with less stiffness in her hands, which she hadn't even mentioned to me initially because she thought it was just aging. See, once the sugar load dropped, her inflammation levels dropped. And her joints responded quickly. And this isn't rare. If you're someone who's been told, it's just arthritis, or, it's part of getting older, and yet, that pain seems to flare most at night, that is a red flag. Because arthritis doesn't suddenly flare like clockwork. But diet-driven inflammation does. Now, I know some of you are still thinking, but I eat fruit during the day, does that count too? Great question. Let's talk about that. If you eat fruit in the morning or early afternoon, your body is more primed to handle it. Your cortisol is higher. Your cells are more insulin sensitive. You're more active, moving, burning, digesting efficiently. But in the evening, everything slows down. Your pancreas slows insulin production. Your liver shifts gears. Your metabolism is preparing for rest, not sugar processing. So when you dump a dose of fructose into your system at 7, 8, 9 p.m., it's not being used for energy. It's being stored. And the inflammatory consequences of that storage are most noticeable when you're lying still, when your joints are no longer moving, but instead, swelling. Let me tell you another story. Paul, age 68. Former truck driver. Came to me for shoulder pain that kept waking him up. No recent injury. No new strain. Turns out, Paul had started making fruit smoothies after dinner. His daughter bought him a new blender for Christmas, and he was trying to be healthy. Every smoothie included pineapple, mango, banana, and orange juice. "Doctor," he said, "I thought I was doing everything right. It's just fruit." After reviewing his symptoms and food intake, I asked him to swap the smoothies for a simple snack. Half an avocado and 2 boiled eggs. Not only did the shoulder pain disappear within 2 weeks, he also noticed better digestion, fewer nighttime trips to the bathroom, and, his words, "I'm not so damn groggy in the morning anymore." That's the domino effect I want for you. Because this isn't just about joints. It's about energy, sleep, digestion, cognition. It's all connected. And fruit, even something as innocent as a sweet little wedge of pineapple, can quietly hijack your body's nighttime healing process. Now don't worry, I'll give you alternatives in a moment. I'll tell you what fruits are safer, how to pair them with anti-inflammatory foods, and when to enjoy them for the most benefit. But first, I need to be clear about this. If you're over 60, and you have unexplained joint pain at night, even if it seems mild or only affects certain areas like your knees, fingers, or lower back, you owe it to yourself to experiment. Just take a break from pineapple and other tropical fruits for 2 weeks. I'm not saying forever. I'm saying observe. Remove the fruit. Keep everything else the same. Watch your symptoms. Watch how your body responds. Because sometimes the best diagnostic tool we have isn't a scan or a blood test. It's how your body feels when you take something away. And the good news? Most people feel relief within 3 to 10 days. That's how quickly the body can calm down once the inflammation trigger is gone. In fact, some of my patients have said they can reintroduce small amounts of pineapple later, as long as it's earlier in the day and not combined with other sugar sources. That's the kind of flexible health I want for you. As we're going even deeper, I'm going to give you a full fruit inflammation scale, which fruits are safest for joints, which are most triggering, and how to combine them for optimal energy and minimal pain. Plus, I'll share my personal nighttime snack formula that supports joint repair, not breakdown, while you sleep. And believe me, once you understand this, you may never look at your evening routine the same way again. Now, I want you to think back to a night when you tossed and turned in bed, your joints throbbing as if they were locked in a slow burn. You might have attributed it to aging, or maybe even to that gardening you did during the day. But rarely do we trace the trail back to our food, especially something as innocent seeming as a piece of fruit. But let me ask you something personal. Have you ever eaten a banana, or a few slices of watermelon, grapes, or even a mango, before bed? You probably thought, it's fruit. It's healthy. And yes, in many ways, it is. These are all rich in vitamins, minerals, and fiber. But there's a deeper layer many seniors aren't being told about, and as your doctor today, it's my job to unpack it gently, clearly, and honestly. See, many of these sweet fruits, particularly bananas, pineapples, grapes, and mangoes, contain something that your aging joints absolutely hate in excess. What is it? Fructose. Now, fructose is a natural sugar found in fruit, and when you're younger, your liver can usually handle it without too much trouble. It processes it efficiently, breaks it down, and turns it into usable energy or stores a bit as glycogen. But when you're over 60, that system isn't as efficient anymore. Especially if your liver's slowing down, your insulin sensitivity is reduced, or your inflammatory threshold is higher, and all three are common once you hit retirement age. So here's what happens. You eat that sweet fruit in the evening. Your body floods with fructose, and because it doesn't process it like it used to, it begins to trigger subtle, almost invisible inflammation markers, especially around your joints. Think about your knees, your hips, your fingers, and your lower back. Those soft tissues become more vulnerable to inflammatory cytokines that get released when fructose is poorly metabolized. Your immune system, sensing that something is wrong, tries to help, but in doing so, it ramps up inflammation. Result? Nighttime pain. It may not happen every night. And you might not connect the dots immediately. But over time, the trend becomes clearer. You eat that sweet fruit after dinner, and your joints whisper, or scream, by midnight. Let me tell you about a patient of mine. Her name is Diane. She's 67, and she came in with chronic nighttime knee pain. She's a retired teacher, walks a little every day, eats what she calls a very clean diet, and yes, she eats bananas before bed. Every single night. Now, bananas are rich in magnesium and potassium, which are great for cramping muscles. But they're also loaded with fructose and starch. I asked her to stop eating bananas for 2 weeks before bed and instead switch to a few slices of avocado or a handful of berries, both much lower in sugar and higher in anti-inflammatory fats and antioxidants. The result? By the end of week 1, Diane reported her knees weren't locking up anymore at night. By week 2, she was sleeping through without waking once from the pain. She was shocked. She thought she was doing something good for her body, until her joints told her otherwise. That's the kind of subtle betrayal we're dealing with. Fruit is healthy, but not all fruits are healthy for every age or every condition. And especially not before bed. Let's go a step deeper. When you eat fruit late in the day, your blood sugar spikes. Yes, even if it's natural sugar. And as that sugar fluctuates during your sleep, it disrupts melatonin production. Restorative joint recovery, and causes a subtle uptick in joint stiffness come morning. Now you're not just dealing with inflammation, you're also facing poor sleep quality, which further limits your body's ability to recover. That, my friend, becomes a vicious cycle. You eat sweet fruit at night, inflammation rises, joints ache, sleep suffers, inflammation worsens, and the pain persists. But there's hope, because once you identify and remove the trigger, you allow your body to return to a more balanced, less inflamed state. Here's something else I want to emphasize. Not all fruits are villains. Some are actually your joint's best friends, if chosen wisely. Fruits like cherries, blueberries, kiwis, and avocados have low glycemic impact, and they're packed with antioxidants like anthocyanins, which actively reduce joint inflammation. They help mop up the oxidative stress your aging cells naturally produce. So while you might want to pause that post-dinner mango or juicy bunch of grapes, you can absolutely enjoy a small bowl of blueberries or cherries without worrying about paying for it later in the night. It's not about demonizing fruit, it's about timing, selection, and portion control, especially when you're managing joint pain and inflammation after 60. So let's recap in plain terms. Fruits like bananas, mangoes, grapes, and watermelon may be worsening your joint pain at night, especially if eaten before bed. Fruits like blueberries, tart cherries, and avocado can help soothe inflammation and promote better sleep quality. Timing is key. Eating sugary fruits close to bedtime can spike blood sugar and inflammatory markers, disrupting your recovery cycle. And let me just say this. If you've been suffering silently, thinking, this is just how it is after 60, I'm here to tell you, it's not. You don't have to endure every ache. You don't have to settle for poor sleep. The answers may be hiding in your kitchen, in that fruit bowl on your counter. And you deserve to know the truth. If today's video opened your eyes and gave you something to think about, especially if you're a fruit lover, then I invite you to take a small step with me. Hit the like button to let YouTube know this message is reaching people who need it. Share this video with a friend, a parent, or anyone over 60 dealing with joint pain. You never know whose life you might help transform. And subscribe to the channel if you want more truth-backed, real-time health talk from me, Dr. Marcus Vail. I'm here with you, not just as a doctor, but as a partner on this journey. We don't fear aging, we outsmart it. And it starts with knowledge, conversation, and action. Until next time, stay strong, stay sharp, and treat your joints with the care they deserve. I'll see you in the next one.